In 2022, the U.S. Surgeon General made a significant announcement. He declared gun violence a public health crisis. This declaration was unprecedented. It highlighted the severity of the issue in America. Gun violence is now a leading cause of death. It affects people of all ages and backgrounds. The declaration was met with mixed reactions. Some praised the Surgeon General's bold stance. They believed it was a necessary step to address the issue. Others criticized the declaration as politicizing a tragic issue. Regardless of the differing opinions, one thing is clear. Gun violence is a complex problem. It demands attention from policymakers, communities, and individuals. This declaration underscores the need for a multifaceted approach. We need to address the root causes of gun violence. This includes access to mental health care, poverty, and systemic racism. Only then can we hope to curb this epidemic. The Surgeon General's declaration serves as a wake-up call. It reminds us that gun violence is not just a criminal justice issue, it's a public health crisis that demands our immediate attention. The United States has witnessed a disturbing trend in recent years, a significant increase in gun-related injuries and deaths. This surge in violence has impacted communities across the country. It has left countless families devastated in its wake. Several factors contribute to this alarming trend. One factor is the easy availability of firearms. The U.S. has a higher rate of gun ownership than any other developed nation. This easy access to guns, coupled with lax gun control laws, creates a volatile environment where gun violence can flourish. Another factor is the rise in mental health issues. The COVID-19 pandemic exacerbated this problem, leading to increased stress, anxiety, and social isolation. These factors can contribute to impulsive acts of violence, including gun violence. The statistics surrounding gun violence in the U.S. are nothing short of staggering. According to the Centers for Disease Control and Prevention, over 45,000 people died from gun-related injuries in 2020 alone. This number surpasses the number of deaths from motor vehicle accidents, making gun violence a leading cause of death in the country. These numbers tell a grim story, but they only scratch the surface of the problem. For every gun-related death, there are countless non-fatal shootings that result in life-altering injuries, emotional trauma, and long-term disability. The economic burden of gun violence is also significant. The CDC estimates that gun violence costs the U.S. economy billions of dollars annually in healthcare costs, lost productivity, and law enforcement expenses. These figures underscore the far-reaching impact of gun violence on individuals, families, and communities nationwide. Section 4. A public health emergency. The declaration of gun violence as a public health crisis is a recognition of its pervasive and devastating impact on society. It acknowledges that gun violence is not merely a criminal justice issue. It's a complex public health emergency that demands a comprehensive and multi-sectoral response. Viewing gun violence through a public health lens allows us to move beyond the traditional approaches of law enforcement and criminal justice. It encourages us to address the underlying social, economic, and environmental factors that contribute to gun violence. This includes investing in community-based violence intervention programs, addressing the root causes of poverty and inequality, and promoting safe storage of firearms. By tackling these issues, we can create healthier and safer communities for everyone. Section 5. The ripple effect. The impact of gun violence extends far beyond the immediate victims and their families. It creates a ripple effect that touches every corner of society. Communities plagued by gun violence often experience higher rates of poverty, unemployment, and social isolation. Children exposed to gun violence, whether directly or indirectly, are at an increased risk of developing mental health issues, such as PTSD, anxiety, and depression. They may also be more likely to engage in risky behaviors, perpetuating the cycle of violence. Gun violence also erodes trust in institutions and communities. It creates a climate of fear and suspicion. This can lead to decreased social cohesion, reduced civic engagement, and a diminished sense of safety and security for everyone. Section 6. A call to action. Addressing gun violence requires individuals, communities, and policymakers working together. We must advocate for universal background checks, red flag laws, and bans on assault weapons. Invest in community-based violence intervention programs to interrupt the cycle of violence. Address social and economic factors by investing in education, job training, mental health care, and affordable housing. By working together, we can create a safer and more peaceful future for all. Remember to like and subscribe.